Allergic disease affects anywhere from 1/3 to 1/2 of the population at any given time. Some examples of allergic diseases include allergic rhinitis or hay fever, asthma, chronic hives, and eczema. Allergic rhinitis is characterized by stuffy nose, runny nose, itching of the eyes, ears, nose, and throat, and often is manifest as dark circles under the eyes, sometimes a nasal crease from the constant rubbing of the nose, and sometimes areas of rough red skin, particularly when eczema accompanies allergic rhinitis in an individual that is predisposed. There are two main types of allergic rhinitis or hay fever. The first is perennial allergic rhinitis, which is a year-round kind of problem, and that is usually caused by allergens such as mite, mold, and animal dander. There is also a seasonal form, which is where the name hay fever comes from, and that is due to the pollens, things like trees, grasses, and weeds. In the Midwest, trees are the main allergen found, or the main allergen that rains down that rains down over a year. So it can be about 75% of the pollen load can come from trees, in particular oak pollen. And that is usually pretty early. That can start anywhere from as early as February 15th to March 1st. And that is then followed by a short break in May. And then grass season is usually the month of June. Sometimes we can be lucky and have a break in July and then have the weeds make their debut in early August. The weeds can hang around until the first frost. So for the seasonal sufferer, there may be small breaks, but really the seasonal sufferer can have problems between February and the first frost. The perennial allergens, such as mite, mold, and pet dander, are a very difficult problem. The most difficult is mite allergen, and this used to be called dust mite, but it really has not much to do with dust, other than that that's how it was discovered when dust samples were taken for research purposes. But mites are really the lowest on the food chain, and these mites are tiny arthropods that are ingesting the skin flakes from humans and pets, and it is the droppings of these mites that is a potent allergen. Many things that can be done to try to reduce the exposure to mite allergen, such as encasing the pillow with a mite-proof pillow encasing, washing linens weekly on the hottest setting, keeping humidity low in the household, and replacing carpet in bedrooms with hard surface flooring. In addition, it is best to reduce fluff in the bedroom, that is, to remove heavy upholstery and a lot of extra pillows or stuffed animals. And those kinds of things can go a long way in reducing some of the symptoms from mite allergy. Pet dander, of course, the best solution is to remove the pet from the home, but when that's not possible, it's always best to at least remove the pet from the bedroom. Asthma is another very common and a very serious allergic disease. Asthma has many symptoms, and any given asthma sufferer may have any combination of these symptoms. The symptoms include things like cough, particularly a dry, hacking cough, also wheezing, which isn't always audible, chest tightness, and shortness of breath. There are many forms of asthma. There is asthma that is only exercise-induced. There is asthma that is due to viruses. And asthma can, in some cases, resolve after childhood, but many times extends into adulthood. It is important to control possible triggers of asthma, and these include things like allergic rhinitis, which we just talked about, but also reflux disease. It is known that heartburn and acid reflux can precipitate asthma. It is also true that smoking, that obesity, that exposure to airborne irritants are all potent triggers. Some of the airborne irritants that are triggers of asthma include ozone, which is, of course, very heavy in times and in places where pollution is bad. Also, exhaust particles. So it is shown that children living near very heavily traveled areas are exposed to those irritants. And strong odors can also be precipitants of asthma, whether it be perfumes or cleaning supplies. Sinusitis is a very important trigger of asthma as well. It is known that people who have chronic sinusitis or inflammation in any of the 5 sets of sinuses will have trouble controlling their asthma. So when sinusitis is suspected, it is best that all measures are taken to resolve the underlying inflammation so that there is a chance of gaining control of asthma. Allergic rhinitis or hay fever is an important predisposing factor to recurring sinusitis. And so often the clinician has to go and test the patient for allergies in order to stop the constant sinus inflammation. It is important when sinusitis is discovered that inflammation is reduced through the use of intranasal steroid sprays. And so these are very commonly prescribed for the patient who has allergic rhinitis, sinusitis, and/or asthma. Another common ailment seen in people with allergic rhinitis and sinusitis is eustachian tube dysfunction. The eustachian tube is the opening of the middle ear canal into the rear of the nose and throat. And people who have either allergies or chronic sinusitis will often complain that their ears are popping or full. And again, the treatment for that is to reduce the inflammation from hay fever or perennial allergic rhinitis through the use of nose sprays, antihistamines, which are usually tablet form, or possibly allergy shots. And in order to get allergy shots, you have to demonstrate a positive skin test, and that is done by an allergist. In skin testing, small amounts of extract are placed on a patient's back in the doctor's office, and within 15 minutes, the physician, the allergist, can read the patient's skin test by measuring the sizes of the various reactions, looking for redness and small bumps on the back, and based on this can concoct a prescription for allergy shots. The benefit of allergy shots is that these actually cure the patient of their allergic disease. There's really nothing else that is a true cure. Because in allergic disease, the immune system is hyperactive and it's misdirected. Instead of going after bacteria and virus, the immune system is instead attacking things like mites, molds, pet dander, and these other things. So by giving allergy shots, the patient's immune system is redirected, and that is desensitized by giving a small amount each week over a period of about 6 months. The patient's immune system learns to ignore those very innocuous things in the environment. So there is a very important interconnection between things like allergic rhinitis or hay fever, chronic sinusitis, and asthma. And all of these have a very big impact on quality of life. People who experience problems with hay fever often have poor sleep habits because they are breathing through their mouths instead of their noses. They can be snoring and having something that represents sleep apnea or very fitful sleep. Also, in particular, children with allergic rhinitis and chronic sinus trouble often have trouble concentrating, and often we see problems with grades in children who have this problem. So it is very important to seek the help of your physician or your allergist when these kinds of problems are suspected.